Welcome back. 9 former leaders of the CDC are out tonight with an open letter alleging HHS Secretary Robert F. Kennedy Jr. may be endangering public health with his policies on vaccines, job cuts, and last week's dismissal of CDC Director Dr. Monarez after only about a month on the job. There's a lot of concern people have, though, about the COVID vaccine, among other things. Dr. Adam Brown is the founder and principal of, is it ABIG or ABIG?
ABIG.
ABIG Health. He's up late with me live tonight here on the Final Five. We had that discussion last time, and right, we went to air, and I meant to ask you again. Good to see you again.
So good to see you as well.
Okay, so last time we had you in here, we were talking a lot about the job cuts, a lot of the funding cuts when it comes to research with public health. One of the big stories over the last couple of weeks has been RFK coming out against mRNA vaccine technology. We're sending a lot of those grants, and that really was the impetus for the COVID vaccine. We're getting into that season where people are considering flu vaccines, COVID vaccines. As you watch this, what's going through your mind?
Well, the first thing, let me just say very clearly that you need to get the vaccine if you can get it for both COVID and for flu. But the confusion that's coming out from the CDC, the FDA, and from the administration right now on who is eligible and who is not is really causing some significant concern, not only to me as a clinician, but to other public health officials, but also to just patients. They don't know exactly what to do, and clinicians are not sure exactly who to trust or what to do on how to advise patients on whether or not they should get the vaccine.
And there was a patchwork of policies across the country during the first iteration when the COVID vaccine rolled out for the first time. And I know there were certain websites where you could figure out where, but it also came down to, where you were state-wise, whether you're in the district. I mean, there's a lot of factors that go into this.
That's right, because there are different state rules on whether they follow the FDA first and then the CDC, or whether it's just the FDA. And that's created some trouble with companies like CVS having some states not carry the vaccine and some patients having difficulty schedule vaccines. But what I'm starting to see now is that some medical societies like the American Academy of Pediatrics have come out to say what the guidelines should be based upon evidence and based upon science, not some of these other type of things that we're starting to see come out of the administration. But I have a lot of concern because what we see RFK doing is creating distrust in the institutions that have kept us safe and kept the American public having longer life expectancy because of strong public health policies. But if we start creating this level of distrust in the institutions that have kept us safe, it doesn't just stop with COVID. It stops with another vaccine. It stops with that distrust starts to go into any of our scientific evidence or new medications. And that's a dangerous place for us to be in the United States.
The numbers I saw, I believe it was somewhere around 14.4 million Americans potentially have had their lives saved by the advent of a lot of these vaccines, whether they be the mRNA, whether they be, I know the Johnson & Johnson shot, which is no longer available, was a bit controversial, but regardless, as we look at all of that going on right now, and you mentioned the distrust, this is also a vaccine, this whole rush to push out, I don't want to say rush, but the push to get these vaccines on the market was something President Trump was very passionate about in his first term.
Exactly, and it's a little bit odd that he would be going back on that and putting trust into RFK Jr., who has been, through most of his career, anti-vax. Yeah. This whole notion about promises made, promises kept, the promise that RFK made is that the vaccine would be widely available. And the guidelines now are narrowing the vaccine availability to people over the age of 65 and adults and children that have a significant medical condition that could cause severe COVID. And that's not working with the scientific evidence that's out there. As many people that can get vaccinated should get vaccinated to reduce the burden on the community and also protect those that are more vulnerable.
There's a term I know that gives doctors like you headaches, and that's I did my research. But we know knowledge is power in times like this, and regardless of how people feel out there, there was something that came out today in Axios, and this was something interesting. The Trump administration has agreed to restore public health web pages. There were a lot of websites, whether it's COVID, whether it's about HIV prevention, that were taken down. Apparently, the administration has agreed to restore a lot of this out there. But for people who might be unsure, and I understand hesitancy, I think a lot of people can be skeptical, but I think finding that knowledge, what's your advice? Where do they go?
Well, first, let me just say that I do like when patients do their research, when they are engaged and they are engaged in the process of working with their doctor. But not all research is the same. And that is the reason why we trust public health officials and scientists who look at research across the country and across the world to make the best recommendations. But right now, the best place for patients to get some of their information around whether or not they should get the vaccine for children is from the American Academy Academy of Pediatrics. They are looking at scientific evidence. The American College of Emergency Physicians are putting out recommendations around vaccines, flu vaccines, and other vaccines. So that's a good place to start. But I was talking about this in my class tonight. I teach at University of North Carolina, Chapel Hill, and I was talking to students about the importance of people doing their research because it's good for them to be engaged in their health care.
I think that's good. That's a really good point. It's great to see you again.
So good to see you again.
Appreciate you coming in.
Thank you.
And your Final Five is back after this.